For 34 years, we have monitored the changing needs of children at risk of abuse or neglect in our community. And a few years ago, a new group of children in need captured our attention and captured our hearts. The Wellness Nursery was born to respond to that call for help.
This week, I had the honor to give my first State of the County address, and I talked about the need for all of us to be creative and innovative and bold and think differently, to do things differently than we've done in the past. That's exactly what Providence House and all of you do. It's so exciting to see what happens when you think creatively and do something a little bit differently.
So many families have reached out and explained to me their plight. You know, sometimes they feel hopeless. They have no hope. They feel alone. They feel that nobody understands. They feel they have nowhere to go. Boy, oh boy, you talk about a dream come true for a family like that. This facility is just that. It's people like you that give people like me hope.
Providence House has always been an innovator in protecting children and empowering families in our community. We've always kind of scanned the landscape of community to see what the emerging needs were. The Wellness Nursery was really an idea birthed out of a need that we were hearing from the medical community, whom we've partnered with for many years, supporting the hospitals when they were serving a mom who was ill or hospitalized and providing a safe place for their children here at Providence House. But about 2 years ago, the calls began to change, and they started to call asking if we could take children who had their own medical conditions, providing them care because the family was in crisis and discharged from the hospital was really not safe for these little ones. We were really blessed and lucky to form a task force of some of the best in our medical community from across the hospital systems to really develop the new Wellness Nursery model. Metro Health Pediatrics, Rainbow Babies and Children's, and Cleveland Clinic Children's Hospital really shared their expertise and worked closely with Providence House and other members of the community to develop this truly unique service that's really the crisis nursery model with 2 additional components. We will be offering complete medical monitoring and oversight for children admitted who have those minor medical conditions, and we'll also be offering the medical skills training that so many of our families desperately need in order to maintain their children's health after they leave Providence House and our Wellness Nursery. Like the traditional crisis nursery at Providence House, the Wellness Nursery will offer care to children newborn through 10 years old. But the difference for these children is that they do have medical conditions. And while they can be discharged from the hospital, the family crisis or the living environment is just not safe or stable enough for the hospitals to feel assured that they'll receive the care that they need if they were discharged home. We're contracting with pediatric medical professionals who will work side by side with the Providence House child care staff to ensure that the children are getting everything that they need while they're here. In addition, the rooms are slightly different than the crisis nursery, including televisions, which we don't have in our traditional nursery, but we know that some of the children coming from the hospital may not be able to leave the bedroom and may be in bed with a volunteer, playing video games, watching movies, reading books together. So we really wanted to make sure that the Wellness Nursery addressed those special needs of our children coming in with medical issues. Currently, our crisis nursery is serving almost 300 children a year, and the Wellness Nursery will add another 100 to 125 children being supported on the Providence House campus. So annually, between 300 and 400 children can now receive their well child examinations right here at the Wellness Nursery in the pediatric clinic, with a connection directly into an electronic medical record for the child so that their hospital medical records are current and reflective of the care they're receiving in the Wellness Nursery. The Wellness Nursery building also includes a new family center. And the Family Center is designed to offer our parents very comfortable, private spaces to visit with their children and meet with our social workers and counselors on their own crises, working on parent education, case management services, crisis counseling, trauma services, and even our 6-month aftercare program. The Family Center is offering services for families in both the Crisis Nursery program and the Wellness Nursery program. So among the nearly 400 children that will be supported at Providence House, that will represent about 175 parents and families a year receiving those supportive services to help their families remain safe and stable.
It would have been enough if Providence House would have just done what it started to do, but year after year after year, like God's loving kindness, it continues to grow and do more. We're lucky to have Providence House in our community. We're lucky to have a city of Cleveland like we do. God bless you all. This is a day of celebration for all the kids who are going to come here, who will have the lives that they deserve to live because of your loving kindness.